Okay, we're starting. One more question. Those who don't speak Russian, you have your headphones, am I right? Who don't understand Russian? Good. That's important logistic issue. That's why you had a break now. It was not planned. Anyway, now we are speaking about the international documents, obligations, and about the role of police in public health. And I'm going strict to the speakers. And one more note that we have recording of this meeting, so all the speakers, including those who do not have presentations, could be then watched one more time to get the references. So that's important source of materials, and we will put in the same folder plenty of recommendations and method guidances which UN system already developed for your reference. So I'm going strict to Neil Woods, who is former UK undercover police officer, and I guess we will hear his story properly. So we will hear from the leader of the association, Professional Association of Police for Humane Approach to People and for Public Health. Hey.
Thank you. We're slightly trimming this session because we're overrunning slightly, so I'm going to try and squeeze in what I need to say. I think, first of all, I need to go slightly off-piste. So please forgive me, because I think we've heard very clearly the human rights arguments, the arguments for the rights to health and the welfare of people who use drugs and marginalised communities. And that is, of course, important and a key part of this. But I just have to throw out that actually a public health approach to drug use and people who use drugs is actually really also very good for policing and police. And we need to have that on record. We need to make that a point of today's event. Now, as an undercover police officer, I, if I'm honest, didn't care much about human rights, and I breached those human rights. I don't think you can work undercover without at least breaching the right to privacy. Nowadays, I talk about human rights as part of my advocacy. I'm also, I'm part of the Law Enforcement Action Partnership, so I'm not just speaking from my own experiences, I'm representing an international organisation. I'm also part of the Global Law Enforcement Association, and I'm working on the drug policy event for the next conference in Ottawa, so if anyone can get to that, I look forward to seeing you. But the reason that there is this growing movement for public health responses to law enforcement is not being driven by the need for looking after human rights. And I'm very impressed that we have a human rights representative within the Polish police. Very impressed. We don't have that in the UK. But it's not being driven by the need for human rights. It's being driven by the evidence of how it makes policing better and easier. Because public health approaches to law enforcement problems are more cost effective and significantly more impactful than traditional punitive measures. So in other words, the evidence is on the side of what we are proposing today. And as a former police officer, I do not think it's unreasonable to ask our police service to operate according to the best available evidence. In the UK, we had an existential crisis within policing for a collection of reasons, but one of them was some high-level or very high-profile miscarriages of justice, where police believed that they knew who was guilty, despite what the evidence indicated. Years later, evidence came to light that the police had hidden evidence which actually indicated innocence of those people who had spent a long time in prison. Now, I'm not saying that the UK policing system is perfect, but it has incredibly improved since then by paying attention to the need for evidence. So we now have highly professional detectives following the rules of evidence. This is now influencing the way that we approach all of policing policy. And that is why we have the Global Law Enforcement and Public Health Association. It is part of what I'm about to quote isn't anything which is public knowledge. This has come from speaking to police around the world, from the information that they hold privately from their criminal intelligence databases. So the police have some evidence in this game that the public does not have. If you send someone to prison, and let's be clear, every single prison in the world has a drug supply. There is not a drug-free prison anywhere. Drugs in prisons are 4 times more expensive than drugs on the outside of prison. And I'm taking that as an average, but it's quite similar wherever you are in the world, actually. In Canada, in the UK, it's 4 times more expensive. There is a sophisticated credit rating system allowing how much debt people accrue and what percentage they will pay on that debt when they come out of prison. This is a significant economic driver to crime that is not talked about in policy terms. And yet the police keep records of this. For those police who follow the detail of criminal intelligence around drugs, we know this. When people come out of prison, they are then routinely criminally exploited, sexually exploited to pay off that debt. This is one of the reasons why we have a sudden increase in shoplifting offences and other low-level criminal offences. This is the activity of the exploitation of organised crime. There was a survey in the UK in the early 2000s which showed that 2 out of 5 people who were problematically using heroin first tried heroin in prison. Clearly, sending people to prison who use drugs, either problematically or otherwise, is very, very bad for society. And it is very, very bad for the workload of police and the relationship that the police have with that marginalised community. We should not be supporting or even speaking in support of a system which leads to an increase in the exploitation of people by organised crime. Now, I've said that I now do advocate for human rights, and it's important that the conversation has been opened with that in mind and led with that discussion today. However, my main priority as a former police officer isn't still human rights. I'm still trying to fight organised crime. That's what I'm still trying to do. And actually, the most effective way of doing that is through a public health approach. If we decriminalise possession of drugs, that is the least that we should be doing. Ideally, we should have a regulated market to take more of the control away from organised crime. In Switzerland, we have the beginning of that. In the Netherlands, they use the Swiss evidence. And what I'm talking about there is that they prescribe heroin. Those governments have taken over the control of the heroin market. And as a result, they do not have a heroin problem. They do not have an organised crime problem associated with the heroin market. I bring to you now a warning from the United Kingdom. In the UK, we have 50,000 children being exploited to deal heroin and crack cocaine. That's because we have an extremely punitive approach. But why has UK been the leader in child exploitation in the drug markets? Well, that's because we have the biggest prison population in Europe. We have one of the most punitive approaches to drugs. We arrest more people for drugs than you do here in Poland per capita. And what that means is that organised crime has adapted. Organised crime will always adapt. And if you take an extra tough approach to the drug markets, organised crime will adapt faster. Because no matter the police operation, the market never shrinks. And in fact, it's been getting gradually bigger. And because it's a never shrinking market, you have to ask, well, if we haven't reduced the size of the market, what is all of that police activity doing? And one of my undercover operations, I was targeting a very infamous organised crime group called the Burger Bar Boys. I'm told that's a very British name for a gang. They're a lot scarier than they sound, honestly. But during that operation, I was stripped naked at gunpoint. I was convinced I was going to die on multiple occasions. I was involved in that operation for 7 months. And in the end, we caught everybody involved in their operation. 96 people, 6 main gangsters, 90 other people. And I thought, wow, we're going to have such an impact on the drug market in this city. And at the conclusion of that operation, with hundreds of police involved, hundreds, we interrupted the drug supply for a whole 2 hours. All of those resources, and not only was that futile in terms of the drug market, the impact was extraordinary because violence went up. When you create a gap in the market, it creates competition because you've created an opportunity for organised crime. Quite often, these operations are instigated by rivals in organised crime who use the information system, the informant system, to get the police, to manipulate the police to do what they want. And if you're a police officer who is resistant to that suggestion, I suggest you study your own criminal intelligence a little bit more carefully. So, I'm a few seconds over my time, but I just wanted to emphasize that these things that we're talking about today, the police need decriminalization, and the police need whatever reforms we can do. And we can all be advocates for that. But at the very least, don't defend the current system unless you can find evidence to support that defense. Thank you.
And I will say for Neil that you as a police officers and your colleagues could join the police association for public health, and that's important tool to have the messages and to develop the messages together. We are coming to the Gorica Popovic-Mostara's Associated Program Officer on Law Enforcement and HIV in UN Office on Drugs and Crimes, and we will hear from the highest official UN body on drugs and crimes what their option about the role of police in the drug policy and public health.
Thank you, Ghana. Way to go to raise the expectations here. Thank you very much. I think it's on. You can hear me. Thank you. So my name is Gorica. I have relatively recently joined UNODC's HIV/AIDS section. And I'd like to start, I don't know if the presentation is visible, yes. I'd like to start with just a very brief refresher on who we are and what we do. So first and foremost, UNODC is a, thank you. So UNODC is one of the 11 co-sponsors of the joint United Nations program on HIV and AIDS, and we are the convening agency for addressing the HIV prevention, treatment, and care among people who use drugs and people in prisons. And in this context, we are working with other co-sponsors, we are working with member states, civil society, community-led organizations, and other relevant partners to ensure that these populations have access to healthcare that they need and the healthcare that they deserve. In this context, I really want to start with the quote. Maybe some of you are familiar with this, and it's definitely something that has been reiterated throughout the first sessions and with my brilliant previous speakers, but I still think it's worth starting with this. Public health is an integral aspect of public safety and security, meaning we cannot separate the right to health for all populations from the right to feel safe in actually obtaining this and realizing this right. In this context, when we're talking about law enforcement, which is a sort of a third pillar of the work that we are doing, connecting both the issues related to people who use drugs and people in prisons, I just want to remind everyone of how vast the intersection between law enforcement and public health actually is. Please keep in mind that this is in no way or form an exhaustive list, and I will not go through all of these, having in mind that we have a short time. But I just wanted to give you a very brief overview of how much these two areas actually intersect, and how important it is to recognize that law enforcement's role goes very well beyond enforcing the law. And this has also been internationally recognized by internationally agreed standards in policing, and you see here the code of conduct, the guidelines for their effective implementation, and also the basic principles for the use of force, all very relevant and instrumental frameworks that guide the way police should be doing their work, and also the way that police are viewed as partners in the international efforts to address drug-related issues. That being said, you've heard this probably to a certain extent today, but I will still repeat that the epidemiology when it comes to the HIV among people who use drugs and people in prisons is unfortunately not showing a very good picture. We still have, according to the latest data from the UNODC's World Drug Report and other relevant reports by UNAIDS and other partners, we still have over 13.9 million people who inject drugs. Among them, 1.6 are living with HIV, 6.8 with hepatitis C. More than or almost 11.5 million people are currently held in prison. And among them, obviously, there is a vast majority of vulnerabilities that put them at risk of infectious diseases and other health-related issues. And as you see from the data, that significant numbers of them, at least the data that is reported, show that they're living with HIV, hepatitis C, and other health-related issues. An important factor when we are looking at the epidemiology and access to services for these populations that is very limited across different countries is how they actually interact, how these issues actually interact with the policing work. And it's been said before, and I will say it again, these stakeholders, police, law enforcement, regardless of the level or the rank that they occupy, are very often the first responders, the first point of contact for people who are marginalized, not just people who use drugs, but other key populations, sex workers, men who have sex with men, transgender populations. And there are plenty of barriers to their that could exacerbate the access to care for these populations that are consistently perpetuated by the policing practices. Obviously, there is the legal enabling environment that's unfortunately assuming a punitive approach, not only in terms of the laws, but also in terms of the policing practices. We've heard about the stop and frisk practices, raids, over-policing harm reduction sites and community-led organizations and so on. Then obviously we have stigma and discrimination along with other structural barriers. And finally, among the police force themselves, there is a very pronounced lack of sensibility and of awareness as to not only the role that they are playing, but also how this role should be operationalized so they are more aligned with public health principles and approaches. The main challenges for the law enforcement in actually operationalizing their role as partners in solution and not just part of the problem is very often the lack of training. Training is sporadic, limited, and does not very often start early. By early, I mean at the level of police academies or police education, so that the early on police officers can be introduced to important public health related concepts, not just in relation to HIV response, but other public health initiatives as well. Then, as we've heard before, there is a systematic emphasis on key performance indicators that prioritize arrest and focus on pure quantitative data, which is very often very discouraging for law enforcement officers, for community police, to actually shift their approaches towards more public health-oriented initiatives. And they are therefore very often discouraged from actually employing discretion or engaging in diversion programs that actually divert people from the criminal justice systems to the services that they need. Then obviously there is a matter of culture. There is a very well-entrenched culture within the police force of being tough on crime that very often does not distinguish between crime and human rights people who are actually very often the most affected ones when it comes to this tough on crime approaches. And the final thing that I will say is that there is a significant lack of feedback. There is significant lack of evaluation of different public health approaches that are already limited, but are insufficiently evaluated to actually inform and show officers that this does really work. It's often very sporadic, very limited to a particular geographical context. And if officers from different contexts have an opportunity to learn from this, as I said, it's still very, very limited exposure. Here I want to sort of introduce or at least spotlight a model of the role of law enforcement in HIV response that is supportive rather than a barrier or a problem or a threat. How would it look like if law enforcement officers at all levels assume a supportive role when it comes to HIV response or interacting with key populations like people who use drugs? We would see an increased access to healthcare services among these populations as they will feel safe and enabled to access the services that they need. And we could see the increase in testing, increase in treatment adherence. Obviously, we could also see benefit in law enforcement officers engaging in collaboration with other important stakeholders, like public health institutions, both governmental and community-led. Civil society organizations and community-led organizations are instrumental drivers of the HIV response and harm reduction responses on the ground, which would enable law enforcement officers not only to learn from them, which is what they absolutely need to do, but it would provide a platform for understanding, for communication, and aligning their approaches so that they actually achieve what they're meant to achieve, which is the safety and well-being of all individuals. And finally, law enforcement's support for harm reduction or HIV-related programs would ensure that these programs are actually functioning rather than being over-policed or raided, and would ensure that the police force becomes a proactive element in the public health responses, especially those that are related to HIV. And how to achieve that? I think it was in one way or the other already mentioned by some of the previous speakers, but it's really worth highlighting some of these elements that through the years of experience way before me in UNODC, but also in my own, we have encountered as relevant or essential steps to ensure that the police are fully engaged as partners in this response. And first would be to recognize that they do have a role to play. This is not something that does not concern them. This is not something where they cannot have a seat at the table or an input that would steer the approaches toward the more public-centered ones. We also need to ensure that we engage with police officers at all levels, but specifically at the leadership level. Having a role model at the leadership level would ensure that the lower ranking police officers, community police, have good examples to look up to, so that they might also, in their own operational work, amend their practices and shift them towards public health and human rights-centered approaches. Obviously, this is an intro into a cultural, operational, and educational internal policy reform of the police, where the approach that traditional policing is assuming can be shifted towards the one that is more oriented toward balanced performance indicators, public health related approaches, human rights, and other more inclusive and sensitive approaches when it comes to policing key populations. Also, it is essential for this to be followed up by regular, consistent training. Building the capacity of the police force at all levels is very much essential to ensure that they can be capacitated to act with knowledge that protects not only the populations that they are policing, but also themselves. Developing forums for dialogue between, as I previously mentioned, different relevant stakeholders is an essential way to ensure that all these actors are working towards the same goal, not against each other, but with each other. Finally, addressing the legal and structural barriers could be also an approach that starts bottom up. And when I say bottom up, I mean, as first responders, law enforcement officers are very often the first one to know what really does not work. And being able to communicate this knowledge to their peers, to their supervisors, senior police officers, and also to their community and other relevant stakeholders is a very important step in ensuring that traditional approaches that may not work are actually amended. And finally, I think it's very important for law enforcement officers to learn from their community, to know their community, not just through drug registers or whatever other operational procedures exist at the police level, but to really understand that the community that they are policing, their unique needs and vulnerabilities, to be able to actually adjust their approach and achieve the true role of police, which is to make everyone safe. And finally, I will try to keep within time and tell you a bit about the work that we are doing. Like I said, UNODC started this work long before my time. 2013, I believe, is when we started working more closely with law enforcement agencies. We have had a law enforcement training manual developed in 2014, which is now being updated because it's been 10 years of knowledge, 10 years of practices, experiences, and different cases that we can learn from that could be fed into the training and education of police officers at all levels, which is why we are updating this training tool. Since 2013, I believe we have built the capacity of over 6,000 law enforcement officers, but only in 2022 and 2023, as you see, we had more than 40 trainings with over 1.6 thousand people trained. We have been committed and have placed a lot of our efforts to ensure that all these stakeholders come together, law enforcement, civil society, public health institutions, to have a seat at the table to communicate with each other and to develop strong partnerships that will not only improve access to healthcare for key populations, but also that will have mechanisms that are sustainable, like referral or diversion schemes at in different national contexts, that are sustainable solutions for diverting people from the criminal justice systems toward the healthcare that they actually need. And finally, we have been and still are very committed to promoting gender-responsive policing, being cognizant of the fact that there are unique needs of women who use drugs, that there are unique vulnerabilities of gender-diverse people and women who use drugs. We are making sure that in our training manuals and in our capacity-building initiatives, we include gender-responsive policing as the way to approach policing these particular populations. And finally, as I previously mentioned, we are very much advocating the reform of the internal policy of the law enforcement so that it actually recognizes the relevance and the added value of public health related approaches to policing and incorporating this into the operational policies and practices of law enforcement agencies. And finally, this is just I will not go through all of this, understanding that we have limited time, but this is just an overview of what the updated law enforcement manual that UNODC is currently finalizing is going to entail, how it's going to look like, and we are hoping to launch it early next year together with the pilot trainings in some of our priority countries. That being said, thank you very much. A special thanks to the organizers and the hosts. It's a great pleasure to be here, and I'm very happy to share the table with my distinguished colleagues. So thank you very much.
Thank you, Gorica, and I need to say thank you for inviting people to the meeting, and that was very not easy work, and all the work which UNODC is doing, and in cooperation with us. So I could believe that that's really years of a good cooperation, and I'm very happy that we have it in this region. That's important. So we are moving forward, and we are moving to very interesting independent power, which is actually the power of justice and power of judges. And I'm now learning the Lithuanian constitution very carefully, so I know how important the constitutional court is for the system, but not only the constitutional court, but the court itself. And for me, surprise was that in our region, we still have the very, very low level of the decision of the judges when they are saying, no, this person is innocent. And I know that in post-Soviet language of judges, there is the term on оправдос, which could not be translated, but that's like very rude way to say that all police did wrong work, and the judge decided that this person is innocent. And for me, that sounds as very unjust to the judges, because they are forced to do some decisions which are prepared by police, prepared by somebody, and sometimes I don't know how judges are feeling. Hopefully we could change it a bit with the help of the judge forum, which we have regionally, and that's one more important cooperation between the UN system, independent power of judges, and us as a civil society is going on. And we are happy that we have here Aurelijus Gutauskas from Judge of Constitutional Court from Lithuania, and long-term serving judge in some of the cases of connected with the drug use and possession and trafficking, sharing his experience with us. Please switch on the Russian translation. For the translation, the Polish language is 1 and English will be 0. So now you should switch on your headphones and make the 0 to listen it in English, please.
Thank you, Gana. Dear colleagues, I'm very happy to be here together with you. Thank you very much for the invitation to take part in this important event. I must apologize for my Russian speech, because I was understanding from organizers that mostly people are participating in the Russian-speaking language skills. So sorry for that, and thank you for understanding. Before I became a constitutional court judge, I will switch in Russian later. Now I am a constitutional court judge, but before that, for 10 years, I was a Supreme Court judge in the criminal division, and also was really dealing with criminal cases related with drug trafficking and other cases. So now I will switch in Russian language. Что касается преступлений и поступков, связанных с хранением наркотических средств или психотропических веществ и наиболее чувствительных аспектов судебной практики, то можно утверждать, что эта чувствительность назначается с правовой оценки правонарушения и продолжается до назначения соответствующего наказания. Не секрет, что в Литве за распространение наркотических средств и психотропных веществ предусмотрены самые суровые наказания среди всех стран Евросоюза. В Литве судебное усмотрение при назначении наказания за преступления, связанные с незаконным распространением наркотиков, весьма ограничен. Никаких альтернатив тюремному заключению не предусмотрено в санкции. Минимальная санкция относительно высока – 2 года. Отсрочка исполнения приговора невозможна. Если смотреть за распространение в крупных размерах, лишение свободы от 8 до 10 лет. Распространение в особо крупных размерах от 10 до 15 лет лишения свободы. Например, 2 грамма героина, 8 лет лишения свободы, амфетамин, метамфетамин, 20 грамм, 8 лет лишения свободы и так далее. К сожалению, строгость наказания не работает. Количество уголовных дел велико, осужденных также велико. Пока люди не понимают, что эта проблема не только потребителей наркотиков, это также проблема общества. Не хватает понимания. Если общество будет равнодушным, то в будущем эти проблемы будут только усугубляться. Наркомания и связанная с ним преступность. Литовский уголовный кодекс опирается на принцип ультима ратио, предусматривает достаточно соразмерные наказания, позволяет суду осуществлять разумную справедливость и применять весь спектр альтернативных мер, если совершенное преступление не является тяжким. Суд может в этом случае освободить преступника от уголовной ответственности или наказания, отсрочить исполнение приговора или назначить вместо наказания меру уголовного правового воздействия. Так кодекс ориентирует судью в первую очередь на выбор наказания, не связанного с лишением свободы, чтобы по возможности дать преступнику шанс. За все годы действия кодекса удалось снизить количество обвинительных приговоров, а значит частично декриминализировать само общество. Все это является своего рода победой науки и практики над системой уголовного правосудия, основанной на эмоциях и мести. Наказание должно быть соразмерным преступлению и личности преступника, индивидуальным, что лишение свободы должно применяться только тогда, когда никакое другое наказание невозможно, что сроки лишения свободы не должны быть очень длительными, и что, когда это возможно, предпочтительнее назначать так называемые альтернативные наказания, которые позволяют контролировать человека на свободу. Конечно, изменению уровня потребления наркотических и психоактивных веществ способствуют многие факторы, и политика контроля над наркотиками является лишь одним из них. Декриминализация, противоположная криминализации, это отказ от уголовного правового подхода к такой или иной проблеме. В более широком смысле декриминализация понимается не как чисто юридическое изменение законодательства, а как переход от репрессивной государственной политики к ответственности за решение социальных проблем девиантных и маргинальных групп другими способами. Такая государственная политика – это политика, соответствующая признакам современного демократического правового государства, современная уголовная исполнительная политика. Нет оснований полагать, что повышение уровня ответственности даст какой-либо ощутимый эффект, так как обзор различных европейских стран показывает, что масштабы потребления наркотиков не сильно зависят от строгости или мягкости законодательной базы, а снижение ответственности может иметь положительные последствия для тех, кто уже употребляет наркотики. Это позволило бы смягчить ответственность перед потребителями, более гуманно относиться к ним и сосредоточиться на наркодилерах. Можно было бы контролировать не только распространенность употребления, но и количество смертей и заболеваемость инфекционными болезнями. Какая ситуация в Литве? В практике правоохранительных органах наиболее часто встречаются преступления, связанные с хранением наркотиков без цели сбыта, и преступления, связанные с хранением наркотиков с целью их сбыта. До вступления в силу Кодекса Литовской Республики об административных правонарушениях в 2015 году за распоряжение, приобретение и хранение небольшими количествами наркотических средств или психотропных веществ в Литве предусматривалась уголовная или административная ответственность. Но с 2017 года за данное правонарушение предусмотрена только уголовная ответственность. Хранение небольшого количества наркотических веществ для личного употребления является уголовным правонарушением. За данное правонарушение наказывается общественными работами или ограничением свободы до 2 лет, либо штрафом, либо арестом. Количество наркотических средств или психотропных веществ, которое считается малым, крупным или особо крупным, определяется приказом министра здравоохранения. Например, малым размером считается количество каннабиса до 5 грамм, амфетамина или кокаина 0,2 грамма, героина 0,02 грамма. Уголовная статья 259 Уголовного кодекса применяется, если количество обнаруженных наркотических средств или психотропных веществ превышает установленный небольшой размер, что наказывается максимальным наказанием в виде лишения свободы на срок до 2 лет. Уголовная ответственность за деяния, связанные с наркотическими средствами и психотропными веществами в Литве, в настоящее время ориентированная на преследование потребителей. После вступления в силу в 2017 году Кодекса Литовской Республики об административном правонарушении и отмены административной ответственности за приобретение и хранение небольших количеств наркотических средств и психотропных веществ, эта нагрузка на систему уголовного правосудия стала еще больше, увеличивалось количество уголовных правонарушений. Ужесточение литовской законодательной базы в отношении преступлений, связанных с личным использованием, приобретением и хранением небольших количеств, и активизация деятельности правоохранительных органов по преследованию этих преступлений противоречит международной политике ООН и Евросоюза, основанной на приоритетах прав человека. Употребление психоактивных веществ рассматривается как проблема общественного здоровья, которая не решается с помощью уголовного законодательства. Большинство обвинений предъявлено по статье 259 Уголовного кодекса, предусматривающим уголовную ответственность за изготовление, переработку, приобретение, хранение и так далее наркотических средств и психоактивных веществ без цели сбыта. Это позволяет предположить, что большинство обвиняемых сами или так или иначе причастны к наркотикам. Это часто всего их потребители. Анализируя потребление наркотиков, расстройства, вызванные их употреблением, и потребности в лечении людей, употребляющих наркотики, можно заметить, что во многих регионах и странах мира растет число нуждающихся в специальном лечении и уходе. Потребители наркотиков и проблемы со здоровьем и поведением, возникающие в результате их употребления, должны рассматриваться прежде всего как проблемы со здоровьем, а не как преступное поведение. Таким образом, если говорить о характеристике потребителей, привлекаемых к уголовной ответственности за незаконное хранение наркотических средств или психотропных веществ без цели сбыта, то можно сделать вывод, что такая ответственность их не исправляет, а только вредит, ухудшает их положение. Наркоманов нужно в первую очередь лечить, а не наказывать. Следует также отметить, что данное преступление не направлено против конкретного лица, то есть это так называемое преступление без жертвы. Поэтому суровое наказание не оправдано и по мотивам возмездия. Преступления против нравственности, к ним также так называемые преступления без жертвы относятся проституция, азартные игры или, что актуально в контексте данного форума употребления запрещенных наркотиков. Конечно, в любом случае наступают не уголовные правовые последствия, последствия для семьи, общества, а в Литве доминирует молодежь с 19 до 29 лет, зависимые или желающие испытать или попробовать. Даже не стоит забывать, что кодекс об административных правонарушениях – это маленький уголовный кодекс. Почему я за декриминализацию? Степень, тяжесть низкая. Тоже можно сказать, что расходы на досудебное расследование очень дорогие. Одним из наиболее часто упоминаемых последствий является рост числа уголовных правонарушений, что также приводит к увеличению расходов на расследование уголовных правонарушений и содержание заключенных, а также к увеличению нагрузки на правоохранительных органов. Кроме того, это сократит расходы правоохранительных органов и судов и позволит перенаправить ресурсы на другие, более тяжкие преступления. Стоимость административного правонарушения для государства гораздо ниже, чем стоимость уголовного процесса. Ну, например, стоимость досудебного расследования за маленькое правонарушение до принятия решения составляет 1300 евро. Один эпизод, один подозреваемый и срок до 3 месяцев. Стоимость расследования тяжкого преступления стоит 56 тысяч евро. Это вопрос, конечно, политической воли, если мы говорим об декриминализации. В контексте контроля над наркотиками в Литве репрессивный характер уголовной политики усугубляется советским прошлым, желанием политиков накопить политический капитал, предлагая более жесткие наказания и дискурсом страха, продвигаемым средствами массовой информации, что часто приводит к тому, что рациональные дебаты тонут в информационном шумихе. Конечно, решение в этой области зависит и от социального, культурного контекста, групп интересов и прошлого опыта. Успешная декриминализация небольших количеств наркотических средств и психоактивных веществ без намерения их распространения может быть достигнута только в результате комплексных мер по изменению наркополитики, предусматривающих не только замену уголовной ответственности на административную, но и оказание медицинской помощи и помощи потребителям, а также социальную поддержку. Если смотреть на стратегию Евросоюза, на наркополитику, она дополняет, конечно, национальную политику. Ее главная цель – обеспечить высокий уровень здоровья, социальной стабильности и безопасности, а также способствовать повышению сознательности общества. И самое главное – предоставить альтернативные принудительные меры. Спасибо за внимание.
I'm sorry that I needed to cut this information, but that's really important piece of information from the court and from the judge who see how to change the situation. And I hope that you will have opportunity to, Mr. Aurelijus will be with us during these days, and I encourage you to come to him and to speak and to learn how does it work in Lithuania. And we hope that situation with criminalization, heavy criminalization in Lithuania will be changed. At least harm reduction now have funding. It takes 5 years of our fight with the local civil society to have funding for harm reduction, and hopefully that the cream will be achieved in Lithuania with our, okay, not very big hope of the last elections. Not look at me like this, but still hope doesn't die on this. And please, I'm giving the floor to UNDP, to Marina Smelyanskaya, and to our passionate partner from UNDP regional office to present the view from the UNDP office on the problems of HIV and justice.
Я начну говорить по-русски, но потом перейду на английский, с вашего разрешения. Я наоборот сделаю, не как Aurelijus. Спасибо, Аня, спасибо организаторам. Мне кажется, что Сегодня действительно Международный день по борьбе со СПИДом, и это очень уникальная встреча, потому что, по-моему, это первый раз, когда мы встречаемся, и у нас в составе полиция и судьи. То есть у нас как бы вся цепочка системы, которая может нам помочь разрешить эпидемию. Как Аня уже сказала, я представляю программу развития ООН, и, наверное, отличительной чертой нашей работы в области ВИЧ и здоровья является то, что мы смотрим на ВИЧ, на здравоохранение с точки зрения более широкого контекста устойчивого развития. Мы понимаем, что здоровье зависит не только от медицины, но и от социальной, экономической и правовой среды, как мы об этом уже слышали сегодня. Поэтому наша цель не только бороться с эпидемией, но создавать системы, которые поддерживают права человека, доступ к лечению и защищают наиболее уязвимые группы населения. Я забыла про свою презентацию. Тут написано то, что я только что сказала. Что я могу вам сказать про форум? Наверное, нельзя говорить про форум судей, не упомянув комиссию по ВИЧ и закону. Глобальная комиссия по ВИЧ и закону была организована с подачи ПРООН в 2010 году. Эта комиссия состояла из 14 экспертов в области права, здравоохранения и прав человека. Один из них сидит сегодня с нами, это Мишель Казачкин, он был в этой комиссии. Между 2010 и 2012 годом комиссия провела масштабное исследование, одно из первых в то время, которое включило 7 региональных диалогов с представителями госструктур, гражданского общества, а также приняла более 1000 письменных и устных свидетельств. И после этого комиссия постановила, опять же, в первый раз, что существует прямая связь между карательными законами и криминализацией и увеличением риска передачи ВИЧ, стигмой и насилием, особенно в отношении женщин. Рекомендации комиссии призвали впервые к отмене дискриминационных законов и принятию мер, защищающих права человека. Это стало основой для создания наших форумов. Сначала форум был создан в Африке в 2014 году, они в этом году отпраздновали свое десятилетие. И затем у нас в Восточной Европе и Центральной Азии. Позже к нам присоединилась также Латинская Америка. Now I will switch to English, so I can be faster. So why are we engaging judges? I think it's pretty clear. Our amazing speaker from Ireland said it's not substances that are being criminalized, it's people. In the same vein, it's not the laws that are putting people to prison. It's the justice system it's the police, prosecutors, and judges that are putting people in prisons. So judges play a critical role, as we just heard from our colleague in Lithuania, in interpreting the law, in influencing colleagues, in ensuring that there can be opravdos in our courts, and pushing this agenda forward. I think the second big issue that we have seen particularly be very important in our region is the fact that the HIV science has not stopped. HIV has been with us for more than 30 years. And it's progressing. Just this summer, this amazing treatment for HIV was announced so that people living with HIV don't have to take medicines daily. They can have injectable medicines and don't have to take pills every day. And similarly, a few years, there's been a release of evidence that if a person is on treatment, HIV is virtually untransmittable. Our colleagues in the justice system need to be aware of this progress and need to be aware of how it impacts their work. Similarly, with drugs, many states are coming to a recognition of the fact that cannabis and even some psychedelics can be used for treatment of various mental health disorders, as well as issues like post-traumatic stress disorder, which I think our region has been experiencing at heightened levels. Next, events like we're holding today are key for peer exchange, for communication, for being in a safe space to discuss issues, and for also meeting people who are completely different than you, than your practice. People who may be representing communities of people who use drugs, sex workers, and LGBT people, and changing your preconceived notions of who these people may be and how they're experiencing the laws that are being implemented. And lastly, I think education is extremely key, and that is why we are so happy to host our judges today. I will wrap up here, but I will say on a personal note, in my past life, now I'm this bureaucrat in the UN system, but in my past life, I'm a harm reduction worker, and I've spent a lot of my time in the United States working with policemen and women, just like yourselves. The US police gets really bad rap. However, US police are responsible for being social workers, delivering babies, resolving community disputes, and a range of issues. As a joke, I've called it parenting with a gun, because, and they're, and so it's not surprising that sometimes their responses are inadequate, because we're all human. And so in harm reduction, we often talk about meeting people where we are. I think this event today, I think our judges forums are about meeting people where they are, in hopefully transitioning from being, maybe a little bit conservative to a harm reductionist. I also want to close with the statistics. In the US, I don't know how aware you are of this. US is experiencing some of the worst overdose rates in the world. And I think there are communities I worked in, where every single family has lost somebody to an overdose. In a country that Anna didn't want to mention today, in Russian Federation, it's a similar statistic of where every family has or knows somebody who's been to prison on drug offenses. I don't want us to be the region with these statistics. So I think that's my final call. Thank you for being here.